Blounts disease is a common cause of knee bowing in children. It can vary from very subtle to very severe bowing in children. And if left untreated, it can even become worse. So today I'll tell you about how I treat these children to prevent the recurrence of the deformity. And don't worry if it sounds very unfamiliar, that's what we're going to break down today. So stick around. A few weeks back, I created a video on bowing in children's knees, and Blounts disease is one of the common causes of that. So today we shall be talking about just that. So in my setting, Blounts disease is one of the common causes of bowing of the children's knees. By bowing, I mean the knees look like this. Blounts disease happens when the inner part of the growth plate of the shin bone or the tibia is sick, so it is not growing at the same rate as the outer side of the bone, and therefore causing the bone to bow out progressively as the child grows. The two major subclassifications of Blounts disease, there is the infantile kind, which occurs in very young children, and there's the adolescent kind, which occurs in older children. So what symptoms make up Blounts disease? There are three things to look out for. Typically, there is bowing of the knees, there is in-turning or in-toeing of the feet, and then when the child is walking, they thrust outwards, so their knee sort of bends more outwards as they walk. Sometimes the children may complain about pain as they walk, especially following excessive walking or activity. When you see this deformity, it's important for you then to go and see your doctor. So the exact cause of Blounts disease is not known, but we know that there are a few risk factors that have been documented to be associated with Blounts disease. One of those is childhood obesity. So we see this in children who tend to be a little bit chubbier or a bit on the heavier end. It's more common in people of African descent. Blounts disease is also seen in children who tend to walk earlier, so early walkers are at a high risk of getting Blounts disease. And also there's been risk factors associated with genetic predisposition. However, it is essential for you to know if it's just normal bowed knees or if your child really has Blounts disease, because Blounts disease, if untreated, continues to progress and the child's knees just keep going and going. The way we can confirm the child has Blounts disease is first by doing a clinical evaluation. So your doctor sees the child and assesses and sees the severity of the deformity. Then your doctor will ask you to have X-rays done. Okay, the X-rays will show that there's a defect in the upper end of the shin bone, and that is how we confirm it. So it is these X-rays that confirm whether it is a Blounts disease or not. And once it is confirmed, then we can move on to treatment. Fortunately, there are effective treatments for bowing of the knees. Um, Sometimes, depending on how old the child and what the X-rays look like, we can manage these by observation. So we continue to see the child and see if this progresses or not. This is most done in younger children, maybe kids under 3 years or so. Thereafter, most of the time, there's need for surgical intervention. The surgical treatments that we recommend vary from guided growth surgery to osteotomies. I talked a while back about guided growth surgery. I'll leave a link for you to check out. Um, the decision on whether to do guided growth surgery or to do an osteotomy is based on the severity of the deformity and also the availability of the resources to the surgeon. When children come in and they're quite young, I typically do guided growth surgery, but the decision on what to do is very patient dependent. So in conclusion, Blounts disease is a treatable condition that is characterized by bowing of the child's bones. It's more common in children who are overweight, children who walk really early, and children of African descent. The treatment is available and this deformity is correctable. If you have any questions, just leave me a comment down below and we'll talk about it. And until next time, keep it on little growing bones.